Well, a growing number of patients are finding they're getting hit with surprise bills from their doctor's offices for unexplained charges at things that used to be free as a patient.
That's right. It's all leading to a lot of frustrations and even more calls for transparency. Spotlight on America correspondent Angie Marashi says that investigators explain why patients are increasingly getting nickeled and dimed.
Cherie Vasquez loves to garden, but hurt her neck and ended up going to a pain clinic in Huntsville, Alabama for help, where she got numbing injections.
It was a doctor's office. I paid my copay, which was $60.
She had 2 visits, 7 injections, and thought that was it.
$979 charge.
But this September, a year later, she was blindsided by additional bills totaling $1,900 on top of her copays and nearly $4,000 her insurance paid.
And they're outpatient services.
The surprise charges came from the hospital that owns the doctor's office, even though she never went to the hospital.
What was your reaction when you saw those charges?
To be honest, I felt anger. They didn't tell me that they were going to bill me separately. They did. If I would have known this, I would have never gotten those injections.
Unexpected fees from doctor's office visits are becoming more common, even for things that used to be free and included in the service, like using your patient portal, room disinfection fees, the doctor answering emails, and writing prescriptions and referrals.
This is another medical bill from a patient in Virginia who also contacted Spotlight. She didn't want to go on camera, but told us she got some slightly bad news at an office visit and cried, then was stunned to see this $20 charge for a brief emotional behavioral assessment on her bill.
We have a system that is dysfunctional and broken.
Cynthia Fisher is founder of PatientRightsAdvocate.org, a nonprofit that fights for medical billing transparency.
It's all about maximizing profits.
She blames charges like these on changes in the healthcare industry away from private practice. 80% of doctors today are employed by corporate entities.
The doctors being owned by the insurance companies primarily and the hospitals and private equity now is its big business.
Spotlight contacted the American Medical Association to get insight on why doctors are charging these fees. A spokesperson told us some services, like answering emails, can be a significant time drain for doctors, justifying additional fees. He also said Medicare reimbursements to physicians have declined by nearly 30% over the past 2 decades and called the Medicare payment system broken. Spotlight also called Huntsville Hospital.
Yes, hello.
Which owns the doctor's office where Cherie went.
Why would she get a bill from the hospital?
The accounting department told us it could be a facility fee or equipment fee. The hospital declined an interview, but sent Spotlight a statement saying the billing practice is the same for every patient and is communicated with the patient up front before the service, although Cherie disputes that.
I decided to fight back. I don't want to pay for something that I don't believe is right and is fair.
For Spotlight on America, I'm Angie Marashi.
And we wanted to see for ourselves just how these growing number of medical bills are impacting people right here at home.
Our Hannah Klein spoke with one-on-one to the West Virginia Insurance Commission to see what you can do to protect yourself. Take a listen.
In West Virginia, the Robert Graham Center says that doctor visit numbers are high, with hospitals experiencing 6.8 million visits annually. 5.6 million of those are outpatient visits.
If I'm not treated very well, then I know everyone else is not treated well too.
The leading cause of death in West Virginia is heart disease, followed by cancer and respiratory diseases, as many people spend time in and out of the doctor's office. With growing concerns over surprise medical bills, we wanted to see for ourselves just how this is impacting families across West Virginia. We headed to the State Insurance Commission to meet Alan McVeigh to see what's happening when we go to the doctor.
So they could basically bill whatever, their normal charges were, which might be greater than whatever the negotiated rates were with the hospital. So you would have a situation where you would go in the hospital thinking that everything would be taken care of in terms of your insurance contract, and then basically get a surprise bill after the fact for greater than what those rates were.
As patients began questioning why surprise bills started showing up after visiting the doctor, McVeigh says that's when the No Surprises Act was signed into federal law.
The No Surprises Act was passed in 2020, became effective in 2022, and then we also wrote legislation, and it's now part of our statute, which allows us to regulate and take care of those situations here in our state, and it matches the federal law. We actually regulate the federal law here in West Virginia just like other states have done.
The law aims to protect the patient from unexpected out-of-network medical bills for certain services, like emergency room visits and non-emergency care at in-network facilities. So we got our hands on the No Surprises Act and asked McVeigh if it's made a difference in the number of complaints they've received.
Well, it's my understanding that we've only had 3 formal complaints since 2022 for this. So it's either working or people don't realize that they can, get some relief from those. Now, maybe some of that happens periodically. I think a lot of times it's a mistake on the provider. Someone new maybe is doing the billing and makes a mistake. But knowing that, we invite people to call us all the time if they have problems like this.
It also requires a provider or facility to disclose their information regarding federal and state balances. They must also, by law, post the information on a public website. McVeigh says that these surprise bills were a big concern for patients who use things like air ambulance services or had an unexpected medical procedure.
Of course, the number one priority of our office is to take care of our almost 1.8 million citizens in this state for all of their insurance challenges, whatever it is. But that was a huge problem. These people were getting bills that were astronomical, and they basically couldn't pay for them.
While healthcare spending in the United States has increased, with the help of the No Surprises Act, patients can have a sense of transparency the next time they visit the doctor.
Why do we have laws? We all have to follow some structure in this country, and that's why we have laws. And basically, that's a pretty good example of having a law that was needed and passing it and taking care of the citizens of this state, and it's working.